So I'm Jenny Roddis. I am Associate Head for Research and Innovation at the School of Dental, Health and Care Professions at the University of Portsmouth. I always feel like my title kind of outweighs me, basically, because I'm forever. When I say that, there's not very many of us in the school. However, there is a wider network of people in our new Centre for Integrated Health and Wellbeing. The centre, like I say, is new. It's recently been established and we now have a director. So Tim is now director of Chywell. I don't know why it's CIH and not Chai, but anyway. So we still are new enough to have not really demonstrated what we're doing, but we are going to become a leader in applied research, promoting and enabling interdisciplinary collaboration to drive positive change in health outcomes. And our priorities are in three specific areas: chronic conditions and healthy ageing, public health and mental health and wellbeing. And you can see quite clearly the links to community health and care, and it's an area the university has been working in for some time. So just in terms of the centre will bring researchers together. Like I say, it's a bit too new to have done anything yet, and that's not only staff from the Faculty of Science and Health I belong to, but also the other faculties, and to create a bit of a critical mass in the area. And like I say, as part of that, there will be community health and care as part of that. We will also, for those academics in the room, will be making a contribution across several units of assessment for REF 2029. And we have some quite clear links into the HDRC in Portsmouth, and also meeting the civic agenda of the university. So I thought it'd be useful to just give a few examples of what we are doing, what we've done so far in terms of community health research. So starting with oral health research, Carolina, I know, was really pleased to be hearing dental care being mentioned several times today. We know that Portsmouth is a bit of a dental desert. There just aren't enough dentists in the area, and access to care is severely restricted. So there are several projects ongoing, one of which looks at access to care, working with the council and NHS commissioners to develop alternative access to care, one of which is teledentistry. So getting people to essentially speak online rather than trying to do that face-to-face dental care. We also have initiatives out in schools with the Brush Up programme, which is intended to educate children in oral health from that younger age, so that children develop good oral health care habits from a young age. And that's not just locally, but that's international as well. And Carolina is in the room if anyone's got any questions or wants to have a conversation with her. Amy is leading a programme of research around falls prevention. She's been working on this for quite some time. She's looking at safer flooring options for older people in particular, and with a view to kind of considering various trade-offs. So obviously, shock absorbency is an issue if someone does fall, but on the other hand, you want that stability to stop people falling, and you want to be able to move things around the room, so you need that traction element, and also detecting falls for when people do fall. She's been working not only with the acute sector, but also with care homes as well. My own work looking at pressure ulcer prevention for older people living in their own homes we're on to our second project. We've identified some of the barriers and facilitators to following pressure ulcer prevention guidance and co-designed prototype intervention. We're now trying to work out who should be delivering that intervention by finding out who is and should be involved in community pressure ulcer prevention. We just concluded the survey for that, and we're just doing some interviews. And then the intention is to lead into a clinical trial, which will probably expand beyond community healthcare to also involve general practice. Rebecca Stores is undertaking an ongoing program of research around sleep and sleep disorders. So previous research had looked starting with disordered sleep for young people with Down syndrome. It's a known issue, but is often undiagnosed and untreated. But that expanded into working with adults around with Down syndrome around sleep issues. She's done some research around undergrad students and their lack of sleep, but also the impacts of that in terms of mental health and well-being. And she's got some ongoing research around the use of, I can never remember the acronym, CPAP, for people with sleep apnea as well. We have, so this is outside of my school, but within the wider centre, we have a breast health research group led by Jo Wakefield-Skur, and the study they've asked me to showcase today is a clinical trial with Portsmouth hospitals and the breast health research group at Portsmouth University, just thinking about the impact of breast cancer treatment and the impact of that on breast biomechanics, and to understand, to inform what we need around bras and post-treatment bras for people who've undergone surgery. We also have a strong interest in neurodiversity, and there's various ongoing projects, so thinking about assessment tools for delivering tailored support for children and young people, various other projects ongoing. I know that research is currently informing the development of a policy in the university around how we ensure doctoral students undergoing their examinations, so vivas and also writing their thesis up, can be best supported in terms of neurodiversity and kind of a particular preparation for that viva and the kind of intensity of that event. Iris is in the room somewhere. She's over there at the back, if anyone would like to have a chat with her. And then Nuno and I have both got fellowships from the ARC Wessex. Nuno is a DEMCON fellow, so his work is around dementia and developing a research agenda around dementia. He is undertaking a systematic review around self-management of long-term conditions for people with dementia. He's recently submitted an application to Alzheimer's UK around peer support mentoring, working with a local community interest group. My own fellowship is a knowledge mobilisation fellowship around community healthcare and social care, and we're still finding our feet a bit with that, but starting to have some very exciting conversations with community healthcare and social care in the area. And just to kind of conclude, really, community health and care is a really key priority definitely for the school. I see it as being where our school is going in terms of research, and definitely for the centre as well, for Chywell. It's kind of core to what they do. We have collaborations with a number of different bodies. We're more than happy to kind of engage wider. What I didn't put on there, and I don't know why I didn't put it on, was PPIE. Clearly we do it. I don't know why it got missed off. But yeah, obviously we do PPIE. But yeah, we're more than happy to kind of start wider conversations. There's not many of us, but we're very keen. Thank you.